Thanks for joining us for this special edition of KPBS News. I'm Maya Tripolsi. It's been a week that has changed everyday life for so many of us. The response to the COVID-19 pandemic has forced Americans to stay inside, to work from home, close schools, and shut down businesses. It's all a shared effort in slowing the spread and protecting the most vulnerable. The steps taken across the country are based on guidelines from the Centers for Disease Control. That's a good starting point for the latest information on COVID-19 and the steps you can take to stay healthy. During this newscast, we'll showcase how San Diego is reacting, from our biotech industry working to develop a vaccine to neighbors finding new ways to help each other, and how schools are embracing online learning. First, let's look at how we got here. The county declared a local health emergency more than a month ago to develop a faster response. On March 4th, the state of California did the same. 5 days later, the county reported its first presumptive case of COVID-19 that did not involve a person in federal quarantine. Then on Thursday, Governor Newsom issued a statewide stay-at-home order. This is a health story and an economic story. San Diego's businesses are taking a major hit, and many people are suddenly out of work. KPBS reporter Eric Anderson looks at what's being done for them.
Calling this emergency meeting of the City Council to order.
San Diego City Council President Georgette Gomez presided over the extraordinary meeting. Only 3 council members were present. The rest joined the meeting by phone. The council convened to ratify the mayor's state of emergency declaration.
Work is slowing down. Businesses are shuttering their doors. Jobs are being eliminated, and tax revenues are shrinking by the hour.
The state of emergency allows the city to seek out state and federal funding to help deal with the impact of the COVID-19 outbreak. But that wasn't the only item the city passed. City officials took steps to make sure the pandemic doesn't hurt those losing jobs or income.
We are working hard, diligently, and making sure that we're creating the proper policies to address some of the anxiety that is occurring because of this crisis that we're facing.
To that end, the council took advantage of an order issued by California Governor Gavin Newsom on Monday. It allows cities to put a moratorium on evictions, both residential and business. San Diego did that. The city also stopped utility shutoffs, put a hold on some business taxes, and urged mortgage companies to voluntarily stop foreclosure proceedings.
The city of San Diego is acting swiftly to help those in need.
The mayor says it is critical that city residents observe the restrictions on public activity. Faulkner says the emergency orders are not optional.
We all know that this isn't easy, but taking these preventative actions will only help keep all members of the public safe and healthy. That is the goal of everything that we are doing.
The city's emergency declaration is in effect for 30 days, but it can be renewed for another month with the support of the council. Eric Anderson, KPBS News.
KPBS.org is a great resource for you right now. We've seen a big jump in traffic as viewers follow our coverage. We have it all for you in a special section. Just click on the Tracking COVID-19 link on our homepage to get there. That's at kpbs.org. Schools across San Diego County are closed. The largest district, San Diego Unified, plans to reopen April 6th, but that could be extended as needed. In the meantime, students who rely on meals can still be fed. The school district has set up 10 distribution sites where people can pick up food. Distribution times are Monday through Friday from 11 to 1. There's a big need. About 60% of kids qualify for free or reduced price meals. And it's not just kids. Local food banks are being called on to help the wider community as people suddenly find themselves out of work. KPBS reporter Matt Hoffman says food providers are also looking at how to help seniors who are being asked to stay at home.
We are, at this moment, able to meet the needs of the people who are showing up at our distributions, but each day as this progresses, the line is getting longer.
Feeding San Diego's CEO Vince Hall says they are seeing a spike in demand for food.
Many people have been living paycheck to paycheck, and now their hours have been scaled back or they've been laid off, and they find themselves suddenly in a cash crisis, making difficult decisions about, do I pay my rent or do I buy food?
To help meet the increased demand, Feeding San Diego is opening up emergency distribution sites. That's where people can get food without having to leave their cars, potentially limiting exposure to the virus.
Our supporters, our stakeholders are rallying. We're purchasing more food. We're upping our game to make sure we have enough products.
The San Diego Food Bank is also scaling up.
We're already feeding 350,000 people a month, and we may be feeding another couple 100,000 a month.
The food bank wants people to know while other stores might be closing, they aren't going anywhere.
We're getting a lot of calls from people that they think that the distribution sites are closing down. They are not.
Both organizations are working to prioritize getting food to seniors.
Many seniors are used to coming to places where meals are prepared and served. Now they are basically isolating themselves away from those sites.
Feeding San Diego is looking at increasing deliveries.
We are also talking with large charities across San Diego County to see what temporary home delivery services for seniors can we spin up in the next couple of days.
The food bank is also working through its partners to expand delivery for seniors and is taking extra steps to ensure safety.
We're doing no-touch distributions or what have you, so we're making sure that those distribution points are safe for those seniors.
Between the two organizations, there are hundreds of food distribution sites across the county. To find one near you or set up home delivery for a senior, officials say to call 211. Operators there will help you out. Matt Hoffman, KPBS News.
Health experts say seniors are the most vulnerable to COVID-19. As a result, local senior care homes are tightening visitation rules. KPBS reporter Amita Sharma has more.
The supply truck rolling into the driveway of Belmont Village Senior Living had what CEO and founder Patricia Will wanted.
I'll tell you what, we're happy to see him.
The supplier, along with Belmont's caregivers, cleaners, nurses, and other essential workers, are the only people allowed at the senior care facility in Sabre Springs, and only after they're questioned about exposure to the virus and their temperature is taken. Belmont, along with other senior homes across San Diego County, has banned all other visits, including by family and friends, to protect residents from the coronavirus. Sanitation of rooms, tables, dining areas has also intensified.
I'm a mother and I'm a warrior. So if you ask me how worried I am, I'm worried all the time. Having said that, we are screening all of our workers. We're taking their temperature. We're screening them for symptoms.
Elderly people are by far the most vulnerable group to coronavirus, as evidenced by an outbreak at a senior facility in Washington state that killed 29 people. The worldwide death rate from coronavirus for people 80 or over is nearly 15%. Will said Belmont residents are applauding the new rules and are finding creative new ways to occupy their time, now that field trips and live music have been canceled. They're playing charades and doing distance artwork. Amita Sharma, KPBS News.
Local blood banks are stressing that there is a big demand for donors during this crisis. That was part of Mayor Kevin Faulconer's message this week. He donated blood at the local Red Cross office. The San Diego Blood Bank says it also needs help. You can go to sandiegobloodbank.org or you can call the number 619-400-8251. It's asking people to book by appointment so it can easily maintain proper social distancing. In recent weeks, a lot of people have been using the phrase flatten the curve, but what does that mean exactly? KPBS science and technology reporter Shalina Chatlani explains why it's key to beating the coronavirus outbreak.
Social distancing is exactly what it sounds like. It's keeping your distance, at least 6 feet, from other people, so working from home, skipping out on happy hours, and avoiding large gatherings, such as concerts. There are a few reasons why officials are asking for this. The first is that many people who have the virus don't know it. In fact, they may even seem perfectly healthy, says medical anthropologist Bonnie Kaiser with UC San Diego.
We're starting to get data where maybe 25% of infections are or of exposures are happening when people are asymptomatic.
That means many people may not realize they're spreading the virus. That's why officials say if there isn't social distancing, the number of people getting sick will grow exponentially. Here's what that looks like.
If you double the size of a drop of water every minute, within less than an hour, it'll fill a baseball stadium.
So for every person who tests positive, another 2 people could get the virus, and those numbers keep doubling. This rate of growth can quickly become a problem because as the number of people getting sick goes up, so will the number of people who need to go to the hospital. And that's where the phrase flatten the curve comes in, says UC San Diego health economist Jeff Clemens.
So one way to think about the health system is that it's there to manage the flow of patient health needs across the population in the same way that a drainage system is there to manage the flow of water that comes from storms.
Now, picture what could happen when a surge of patients check into doctors' offices across the country. Remember, we're talking exponential numbers.
So the idea behind the social distancing and the flattening out of the curve is essentially an effort to sort of spread out the flow of patients so that it doesn't overwhelm the system like a major storm at any one point in time.
Countries around the world are implementing social distancing measures like quarantine in order to reduce the flow of patients into the healthcare system. In Italy, lessons have already been learned. There, last week, nearly 400 people died in just one day. Manuela Raffatellu is a scientist at UC San Diego who's also from Italy.
So this was just, I think, the tip of the iceberg. The disease has been spreading, and especially started in northern Italy, that I would like to highlight. This is the best healthcare in the country and one of the best healthcare system in the world.
But Raffatellu says some people didn't take seriously how contagious the virus is, so the disease spread.
In the city of Bergamo right now, which is a city near Milan, they started quarantine a little later than other cities, and this 1 week delay for the lockdown really cost them a lot. You know, the entire newspaper is basically dedicated to people who died, you know, in a very short time.
Doctors even in northern Italy are having to make tough calls on who can be seen because medical staff is limited, or they have to decide who can get life-saving supplies that are running out. And economist Jeffrey Clemens says in the United States, the hospital system could easily get overwhelmed as well.
The system as a whole, you know, has roughly 1 million hospital beds, of which 100,000 beds are intensive care unit beds. And so in the event that we were to see a surge of COVID-19 infections, that system could very easily be overwhelmed.
And Raffatellu says it's important for people to think about who needs those beds the most.
Our parents, our grandparents, our neighbors, and so we need to do this even if we are healthy.
And remember, flattening the curve isn't about panicking. It's about keeping a safe distance so we can slow down the rate of the virus. Shalina Chatlani, KPBS News.
A local lab is hoping to fight the pandemic with its experimental DNA-based vaccine. KPBS health reporter Taryn Mento has been following the progress at Inovio Pharmaceuticals and brings us this update.
What's the latest with the vaccine?
Yes, certainly. So we've managed to accelerate the timelines considerably, Taryn. So we're now looking at getting into the clinic next month in April. We don't have an exact date yet, as you can imagine. There's still a lot of organisation, a lot of moving parts at the moment. But when you think that we only started designing this vaccine on the 10th of January, it's pretty remarkable that we're aiming to be in the clinic by by next month. And another goal that we've set ourselves is that by the end of the year we hope to have 1 million doses ready for distribution, which is really quite a remarkable scale up from kind of a small scale trial like we're doing at the moment.
There's still a lot more testing to go.
Yep.
Why have 1 million doses ready for distribution by the end of the year? What's the point?
I think it's just really good to have a figure to target. We thought that on the scale-up basis, targeting 1 million doses, it's still a significant number, a number that could be used to really protect people, healthcare workers, frontline medical professionals that are going to potentially really need this vaccine, and also potentially people who have underlying health issues as well, which is obviously a tier 1 group that needs to be protected.
Is the expectation that you would have completed all 3 trials by that time?
No, absolutely not. So as I mentioned, we'll be starting our phase 1 testing in April. We would hope to get what we call an interim readout, which means, you would start to get to see, you wouldn't get the whole through trial, but you'll get to get some of the data out of that, certainly by late summer, autumn, fall type time. And then we would be hoping to move into phase 2, which is where we can actually ask the question, does the vaccine work to protect people against the virus? And we would hope to do that very, very quickly. But that would have to, of course, have the say-so of the regulatory authorities.
And with the first phase of the trial starting next month, I believe you've already identified those locations, correct?
That's correct, yeah. So we're going to be 2 sites for our phase 1 trial, starting in the US in April. We're looking at 1 site at the University of Pennsylvania and 1 site in Kansas City.
Based on what you know about how this virus works and how viruses like it work, is this what we should be doing, or should we be doing more? Should we be doing less?
To be completely honest, we don't really have a choice. If we don't do what we're doing right now, the situation will get a lot worse a lot more quickly. So I'm very supportive of all the measures that have been put in place, both at the sort of local and national level. It seems like the testing now is starting to come through. We're getting higher numbers of testing, and that's absolutely critical. So that's a positive, definitely, and I'm sure over the days and weeks that's going to improve more and more. In late December, when I first heard about this virus, if anybody had asked me, would we be essentially shutting down all spheres of public interaction in San Diego in a couple of months' time, I think I wouldn't have believed that would have been possible. And yet here we are today, and it's a reality, that my children are at home and, predicting not to be at school for another month. And it's almost hard for me to get my head wrapped around that, and I kind of am living and breathing this every day, so I can't imagine what it's like for everybody else.
Well, thank you so much.
We want to remind you about a partnership between KPBS and the San Diego Unified School District. It's called At Home Learning, where children matter. Just by turning on the TV to KPBS 2 or any of the channels on your screen, students can watch PBS content designed by their grade level on a block schedule. Grades pre-K through 3rd grade can watch from 6 to 8 a.m. Grades 4 through 8 can watch from 8 to 1 p.m. And high school content will be on from 1 to 6 p.m. There's also an online library that can be accessed on any smartphone, on tablet, or computer at pbslearningmedia.org. For many of us, this week brought a crash course in technology as America works from home. That's especially true for teachers who are trying to educate and connect with their students remotely. Evan McMorris Santoro reports.
So who's going to be in the class today?
The running list of school closings nationwide changes by the minute due to coronavirus. For the time being, the face-to-face school day has been replaced by e-learning. Many college students may be used to logging into school, but now online learning has become the norm for students of every age.
So we have 4 classes a day with 15 minutes in between each class and a 30-minute lunch break.
Sam Montag is 13. This is his first day attending 7th grade from his bedroom.
I think going online is a smart idea because we don't know when we'll be able to get back to school. No, 12 y 12.
Westminster School, a private K-12 in Atlanta, is trying to make online school as close to regular school as possible. So the day starts with homeroom, from home.
Just follow what I'm doing. Everyone's doing it.
Carolina Mars has been teaching French and Spanish classes for 8 years. For the past few days, she's been translating her classroom lesson plans into e-learning.
We've been working on learning how to order food and being open-minded about trying new foods. Field trips are completely out of the picture now. And so we are trying to change the focus of this unit to be, instead of ordering food, to cooking at home.
This is the first day she's wrangling her students from her dining room table.
And we have everyone in class. Applause, everyone made it. Très bien.
Control over the class is one thing that I just have to let go of. I'm not there, so I'm not going to have the same amount of control.
The obvious question, is this going to work? Online education has been around for a long time, but it's never been tested quite like this.
You know, there's that rule or that guideline that your attention span is only as long as your age in minutes. So for middle schoolers, we're talking attention span is usually 11 to 14 minutes max.
Do you think that you can leave your students with the same kind of education that they would have if they were with you in the classroom?
Yes, I can probably cover everything that I need to cover, but education is so much more than what we cover in class. All extracurricular activities, robotics, all of that is part of a student's education.
That was Evan McMorris Santoro reporting. Entertainment is also suffering right now. One of the biggest draws in San Diego, the Padres, aren't sure when they'll be able to play. The season was scheduled to start next week at Petco Park. Now Major League Baseball is saying mid-May at the earliest. In the meantime, the Padres say it's setting aside $1 million to pay its part-time stadium workers. Business is booming in one area. There's now a huge demand for delivery. Here are just a couple of examples. Domino's says it will hire 10,000 people to meet the increased demand. That includes positions in stores and factories. Amazon will also go on a hiring spree with plans to add 100,000 workers to its distribution centers. The company is also giving its workers a boost in pay through April. Neighbors in San Diego are reaching out and offering assistance to one another. It's called mutual aid, and it could save lives. KPBS reporter Max Rivlin-Nadler has more.
Through websites like Facebook or Nextdoor, neighbors in San Diego began to reach out to one another this week. They were asking if people needed anything like food or sanitizer, but couldn't make it out to the store, or it wasn't safe for them to do so. One group of neighbors and activists trying to coordinate this type of community response is called We All We Got SD. Christina Griffin-Jones started the mutual aid group this weekend with fellow organizer Candy Custodio-Tan. Griffin-Jones says the goal is to connect people who can help to those who need it without getting anyone exposed to the virus, and making sure that people stay in touch with each other, even if it's just through a phone or video call.
Because mutual aid is also information, right? Mutual aid is checking on folks via Zoom call, right? Mutual aid is text messages, phone calls. It's not just this physical stuff or this monetary stuff.
The organizers say they're not trying to reinvent the wheel. They want to spread information and make sure that people who need help can find them from either their neighbors or existing resources. They've gotten requests from people needing sanitary wipes, food, meat, non-perishables, and just someone to talk to. Without an active community during this time, the organizers believe the most vulnerable of our neighbors will fall through the cracks.
We are here kind of in our communities. It's like the whole thing that when you say we all we got, it's welcoming because I got you, you got me, and the more we all look out for one another, the bigger that is.
You could find more details at weallwegotsd.com. Max Rivlin-Nadler, KPBS News.
We can all use some positive stories right now, and there's plenty of them across America. People are coming together at a distance to help each other out. Martin Savage has some of those stories.
These may feel like dark days, with headlines of contagion, fear, and hoarding. But human sunshine still exists. Random acts of corona kindness are everywhere. Like a front porch in Columbus, Ohio, where a young brother and sister put on a concert for a 78-year-old neighbor who had shut herself off from the virus and the world. Dressed in their best, the 6- and 9-year-old delighted their audience of one. In Italy, where so many have died and so many more are isolated, they sing to each other from balconies. At night, voices echo through the streets with canine accompaniment. In Spain, where they're also suffering, to say thank you to doctors and nurses battling to save lives, people step outside and applaud everywhere. In Houston, at Irma's Southwest restaurant, now ordered closed, a couple left something behind, a $9,400 tip. To pay your guys over the next few weeks, the anonymous note said.
This is beyond. I mean,
I don't even have words for it. I just really don't.
We have to let our staff know that we may be off for work for 15 to 30 days, depending on how long that is. But the gift we got today should help soften the blow.
At a Cleveland watering hole, also closing, a customer added a little something extra to his less than $30 bill, $2,500 for the staff. When the NBA stopped the games, Cleveland Cavaliers basketball star Kevin Love started thinking about the arena staff without work. He donated $100,000 from his foundation to them, hoping others would follow his lead in their towns. They did. Teachers may not be rich like athletes, but they have a wealth of knowledge, and on Facebook many are sharing it to answer questions and help others learn. Elsewhere, the elderly are on the minds of many. People offered a grocery shop for those who cannot or may not want to leave their homes. Stores have begun allowing older customers their own exclusive shopping hours to limit exposure to crowds. And when coronavirus concerns prevented her from going into a North Carolina nursing home to show her grandfather something, a young woman stood at his window, simply pointing to the engagement ring. The virus, forcing us apart, seems also to be bringing us together, closer than we've been in a long while. Martin Savage, CNN.
And a reminder that you can find all of our COVID-19 coverage at kpbs.org. Click the Tracking COVID-19 link on our homepage. Thank you for joining us for this special edition of KPBS News. Take care and stay safe.